And as usual, I'm doing my brief little Friday nights for the future Substack piece. I will put it up on YouTube if they let me put it up on YouTube. And the topic of the day is women's health. Something, hi Phoebe, something we always talk about, right? And this time I am ranting because I am so upset with this new PMOS. All right. So, does anybody understand that they have just renamed a condition that they have been evolving an understanding of for probably 30 or 40 years? Polycystic ovarian syndrome is how it started off. Next, it became polycystic ovarian disease. And now it's up to 15 syllables. Can I say that again? 15 syllables. Polymetabolic endocrine ovarian syndrome. I'm going to suggest to you all that the more syllables, the less the doctors know about whatever it is they're talking to you about. It does seem to be inversely proportional. Yep. And that's a problem. I'm speaking about a time when, if you really want to call this by another name, PMOS, how about poisoning my ovaries and shit? Okay, because that's what has happened. All right. Ever since we started messing around with hormones, and I mean it in the environment first, before we started doing them in our bodies, we were messing with hormones back in the 1950s. Read Silent Spring. Rachel Carson was a marine biologist who helped people figure out that there is a problem related to our environmental exposures to our cancer risk. And she was doing this because she herself had a cancer diagnosis and there was nobody in her family with cancer, and she's trying to figure it out. And she figured out, whoa, I think some things are poisoning us in our environment. So here we are now, and we have a lot more information. And yes, we have things that are called estrogen disruptors. A lot of them are in the pesticides that we used, DDT and Roundup. Manage our crops. So that is getting into your body through your food, through your water. Our water is often recycled, and what's happening in our reservoirs is if we pee out estrogen and testosterone into the water, it goes back into you and not necessarily at the right amounts. The other categories of substances that are really bad for us at this moment in time would be environmental pollutions that we breathe in, landfills that we live near, and of course we just had all those bird watchers go down to watch birds on a landfill, and suddenly people are like, well, maybe that's not such a good idea, huh? Because they came back with the hantavirus. That's for people who don't know how that particular issue got started. So we are having a lot of problems not recognizing that if you breathe, you're going to have to pay attention to what air you're breathing. If you're drinking, you're going to have to pay attention to what's in your water. And if you're eating, you're going to have to look at what has piled up on the food chain in what you are eating now. The higher you are on the food chain, the more likely you are to have concentrated levels of some of these poisons. Example from my own life. Usually, we doctors used to say you expect to have your own children reach their puberty within about a 2-year window of when you yourself reach puberty. Like, so if your mother and your father were like 4 years different, you're going to have to factor it in. But I went through menarche, my first menstrual period, at age 13. Often you get breast buds as the first thing as a female person, and within 2 years you're going to have your period start. My daughter had a breast bud at age 9. I'm like, that would be 11. That doesn't sound right. I immediately took her off of everything except organic meat. All right, no dairy, no meats that were potentially going to be giving her this extra estrogen that she didn't need in her system, and those were the only places I could control. She got her menstrual period at 13, so whatever I did slowed things down enough. But that's the level of awareness we're going to have. Welcome, Pauline. Nice to have you. This is a conversation loosely on the fact that the more syllables the diagnosis has that has to do with your women's reproductive system, the least likely it's going to be that the doctors who are taking care of you know what they're doing. It's that basic. And I just said metabolic endocrine ovarian syndrome is too many syllables, and those doctors don't know what they're doing. The other place that we recently got very badly burned was with COVID. Women's health, they did not test any of those 3 vaccines and monitor women's menstrual periods. In other words, they didn't factor in any of the symptoms they didn't even ask checklists of any of the symptoms women might experience as changes in their menstrual cycle. And of course, women had many changes in their menstrual cycle with the COVID vaccines. It was one of the reasons women were hesitant to take the boosters. We didn't talk much about that. That was a problem. Other illnesses that have been multiplying the number of syllables started way back in the day with osteoporosis. All right. I always start there, and I've done this several times because it's the first time in my lifetime that I saw a manufactured problem. 1 in 7 white women will have problems with thinning of their bones, osteopenia, and it may progress to osteoporosis. That's the commercials that they used to have on when we used to have television, where you see this upright woman and she goes into an old hag as her back gets bent and she has crushed vertebrae. So that was the commercial that went with, you need to have support of your system hormonally, and osteopenia can be prevented from becoming osteoporosis if you take these wonderful drugs called Premarin. Well, you need to understand that Premarin was a failed chemotherapy agent. It did not work for uterine cancer as they thought it would, so they looked at what it did. And what it did was it held on to bone. So if you were having thinner bones, it kept the bone at the thinness and it didn't go further down. That's what your Fosamax now does. That's what the Premarin was marketed to be doing. And I always say, what wool were they trying to pull over our eyes that they name a drug pregnant mare's urine, and we're supposed to just Premarin? Isn't that a pretty name? To me, that's one of the most obvious examples of a male-dominated system that really doesn't give a rat's ass about women's health. It was so patronizing and in our face. Next thing that happened like that seems to have been a condition you may not have heard of, but it's very, very challenging, particularly for colored girls, Black and Hispanic women. Hidradenitis suppurativa. How you like that? That's a lot of syllables, right? Hidradenitis suppurativa. It means that you get these awful, awful boils, infected areas that swell into little abscesses, mainly in your groin area, in the pubic hair, and under your arms in the pubic hair. And what is the treatment that they've come up for this? Excising the skin, taking the entire skin out from under your arm and like grafting. What is wrong with our medical system? Eating has how you eat affects this. How poisoned your metabolic system was that you had this wacko response with these boils developing up under your arms and in between your legs. And one of the most practical, early things that a woman, because this happened more in women than men, could do is stop shaving. Okay. So each of those little hairs that you shave, if you've got curly hair, it curls down and makes it more possible for a boil or a blister to form. How comfortable are American women with hairy legs, with hairy underarms, right? And if the treatment is going to make you less beautiful, what does that do in a culture that has such weird values? Hidradenitis suppurativa, that's what that one was. Next, we have all of the acne problems that women have had since our hormones are so out of balance. Uh, you clean up your food, you clean up your behaviors, like not touching your face. That's hard for teenagers, but you clean up your behaviors and you don't have such big problems. But we went all out and have been giving systemic drugs, chemicals that you take, pills that you take for acne on your face. I don't think you'd be happy if you heard me say that there's a kind of pancreatic cancer that's associated with one of the drugs that we gave teenagers for their acne on their face. And you're not going to figure that out for 20 or 30 or 40 years. But that's where we are now with problems that we created that don't show up for 20, 30 years. And we have to pay attention. Moving right along, I get on my soapbox a lot about perimenopause. Because if you talk to women who are 60 or older, they'll say, what? Because we didn't have a word for problems that happen between the age of 35 and 50. 50 being the average time the average American woman starts to have that 1 to 2 years when she doesn't release an egg at all. That's what menopause is. You stop releasing an egg and you don't have a menstrual period. And guess what? You could have heteronormative sex as much as you want and you don't make babies. And they don't ever want to emphasize that part. But that is a big part, that it was a piece of what women looked forward to. So now we have a whole generation of women I'm seeing in their 30s worried, so worried about perimenopause, just like we suddenly became worried about osteoporosis. But perimenopause is now a catch-all for anything that happens to you emotionally or physically between the age of 35 and probably 50 that's related to all kinds of stress and poisoning that's happening to your body. I can't say enough. We are poisoning our bodies in ways that we don't notice, and stress poisons you. Your cortisol, every time you get stressed out, your cortisol is jumping up. It's giving us problems with high blood pressure. So it gets very, very messy. I am in the final little piece of driving to my home as you see me jumping around all here. If anybody has questions, please ask me questions. But I'm going to wrap up in 5 minutes here and just say polycystic ovarian disease syndrome, or metabolic endocrine ovarian, whatever you want to call it, is such a big deal. It's down to 1 in 8 women in the United States suffer from this. When I started medicine, it was 1 in 10. A piece that nobody talks about but is documented is somehow or another this is connected in very bizarre ways to what's happening in the middle of your head with your pituitary and your hypothalamus and all of these glands, these organs inside your head that are related to stress, but in such an interesting way. There's been a correlation, and correlation does not mean causation, but there's been a correlation. Oh, there's a rainbow right in front of me, guys. I have to just say, it's really beautiful. There's a rainbow. Um, Correlation between sexual abuse issues and polycystic ovarian syndrome disease, or polyendocrine metabolic disorder. It's so symbolic to me because when we were looking at polycystic ovaries as just the ovaries, what would happen is the capsule of the ovary gets tough. It doesn't let an egg just pop out the way it's supposed to each month. Each month, an egg's supposed to pop out, kind of like a piece of bubble gum, right? Just one. And when you have polycystic ovarian syndrome, one of the symptoms is the eggs don't pop all the way out. They just kind of bubble up, and you'll see an ovary that has like 5 or 6 bubbles that haven't popped through and had the follicle totally release. So that feels like a woman trying to protect her creativity. And, your ovaries are your creativity. So, on that note, I'm going to finish early because I'm at my door. I just did stopping. There's a few of you there, and I will follow up with some more information in an essay. But I just wanted to say hello, say in a rant, poisoning your ovaries is a bad thing, but your whole body is poisoned. So pay attention and take care of yourselves out there. Okay. I'll post this to YouTube tomorrow for people who haven't caught it. Dr. O signing off. Thank you so much.